Hello everyone, I'm Mike Putman reporting from ACR 2024. Today I want to tell you about Abstract 501, which reported one of the results of the JAK-pot study. And I'm very excited to be interviewing Dr. Kim Lauper from Geneva for that. So Dr. Lauper, welcome. And I'd just like to start by asking you, so what did you do here with the JAK-pot study? What was it all about?
So JAK-pot is a collaboration of registers that we started because we wanted to look at safety and effectiveness of JAK-inhibitors in real world. So we have up until 21 registers that work together to answer research questions.
I think it's a fascinating topic, and in the wake of the oral surveillance study, I think we've all been very concerned about JAK safety, and then also it's just interesting comparing DMARDs. There's not a lot of comparative effectiveness research, and one of the things I have always heard about and wondered about is whether or not JAK inhibitors work faster than TNF inhibitors, and so that kind of piqued my interest in this abstract. So why don't you tell us about what you studied here and what you found?
So yes, so the idea was really comparing most of the second-line treatment we have in RA. So we wanted to compare JAK inhibitor, TNF inhibitor, IL-6 inhibitors, and Abatacept, and see if there was one of these treatments that was acting faster. And for this, so we collected data from 12 of the registers of JAK-pot that had data on 3 of 6 months after starting the treatment. So what we saw is that all the treatment really act really fast in the first 2 months, then they act a bit slower and in terms of CDI, pain and HAQ. And then we compare them adjusting because of course it's an observational data, so there were some confounders. So after adjusting, what we saw is that JAK and TNF inhibitor was still faster in terms of CDI, HAQ and pain than the other treatment, which was surprising for us.
Yeah, I thought that was surprising for me as well. I mean, I would have expected JAKs to be faster based on what I knew already, but the curves on your poster really looked superimposed. There was no real difference between them, so quite an interesting finding. Were there anything else that you gleaned from your data that you thought would be clinically relevant for folks?
So we saw that Abatacept was a bit slower than the other one, but what I can say is Abatacept, we really have not a lot of patients that were really in early RA. So we've seen that Abatacept maybe works better in early RA. We can't say anything about that in our data.
That makes sense. I always like a measured conclusion. Well, so I think this is a very interesting study. It definitely will at least impact the way I see starting DMARDs, and I think my preference has been trending towards TNFs as first line, especially given some of the safety data. So final question for you, is that your practice as well, or how did this change your practice?
Yeah, so I'm really more comfortable starting with TNF inhibitors because I see that act really faster, and that's then gonna be my practice.
All right, I love it. Well, thank you so much for joining me. Thanks so much for following all of our content on Room Now. You can follow me at EBRoom. And Dr. Lauper, what was your Twitter handle?
K_Lauper.
All right, I follow her as well, and everyone else should too. Thanks so much for having us, and hope you're all enjoying the meeting.